For our guest on this episode of the Cancer Interviews podcast, her journey did not end with survivorship. This is your host, Bruce Morton. Claudia Tatum of Tulsa, Oklahoma survived kidney cancer, but she has made it her life's mission to give back, to help others. This is her story, and now let's hear it. Claudia, welcome to Cancer Interviews.
Hey, thanks, Bruce. Thanks for having me. This is exciting. I've never done a podcast interview before.
Well, there's a first time for everything, and this is the first time for your podcasting interview career. The first thing we do, Claudia, when we start is we want to know a little bit more about our guest because each of our guests have a life exclusive of cancer. So if you would, tell us a bit about where you're from, what you do for work, and what you do for fun.
Got it. Hey, I am from the East. I grew up in East Mississippi, West Alabama, Meridian, Mississippi, to be specific. I live in a suburb of Tulsa now. I am a longtime radiation therapist and oncology nurse. So the world of oncology has pretty much been my life, all my adult years. I retired from full-time work as an oncology nurse at St. Francis Health System the end of February of 2020. I was turning 65 and retiring, and had all kinds of great plans. And that was when the COVID shutdown happened. So my retirement plans and my 65th birthday plans kind of changed. But that's neither here nor there. So I enjoy being outside, walking, hiking, traveling. I was a scuba diver for 15 years and I realized all my vacation time was underwater. So it's like, and then I started having some issues with my eyes. It's like, no, I think I'm ready to do something else. But as you mentioned, I like to volunteer. I'm not married, I'm divorced, and I have no children, so I have no grands. So work and volunteering, those are my hobbies. That's what I enjoy doing. I like cooking. Just hanging out with friends, doing different things, getting off the beaten path, but mainly, being with people and experiencing new cultures and learning things. That's what I like to do.
Claudia, for all of us who are cancer survivors, there was that point in time in which things went from a physical perspective from normal to abnormal. When did you first notice that something wasn't quite right?
Well, it's one of those things, Bruce. In retrospect, I can put the whole puzzle together. I had probably, as I was retiring even in early 2022, before COVID or as COVID shutdown was starting to happen, we'd been pretty sedentary then. You couldn't get out, you couldn't do anything. All the plans were canceled. So, I was probably fatigued then, but I didn't really realize it because we weren't doing very much. But I'm still outside walking and enjoying myself. But I guess it was October of 22. I was having my annual Medicare physical with my primary care, and lab works good, everything's fine. And she goes, well, have you got any problems? I said, no, I have a little bit of pelvic heaviness. And so we start to think GYN issue. So she sends me to a GYN. Turns out, I'm recommended to have a hysterectomy. Well, golly gee, who wants to sign up for a major surgery if you don't really need it? I was trying to, but I wanted to be smart enough about it. So that was when I said, I guess after the first of 2023, this year, I said, if I'm looking at a hysterectomy, I really want to get this cough I've got worked up because I've got this chronic cough that I probably had for almost 2 years now. And meanwhile, the previous year in 22, I was seeing an orthopedic guy. I was getting some physical therapy for some back pain. I had some vague GI issues, which I'm just attributing that to, my gosh, I'm almost 70 years old. Doesn't everybody take Tums? Aren't Tums in your car and by your bed, that kind of thing. So there was a lot of vague things that really didn't add up to too much. But as I tell my primary care that I want to get this cough worked up, she sends me for a chest x-ray. So everything looks pretty good. I had a couple of 3 millimeter lung base nodules. And because of that, they recommended a CT of the chest. So CT of the chest confirmed that, yeah, she's got those little small lung-based nodules they're stable and unchanged since 2011. Heart and lungs are good. There's some densities in her left breast. I knew that. But there's also a very large left renal mass, and this is exactly the way it said, consistent with RCC. So I'm reading this on my phone out of my patient portal. Most people won't even know what RCC is. Being a long-time oncology nurse, I knew what it was. It's a renal cell carcinoma. It's like, oh, holy moly. And it was like a 9 or 10 centimeter mass. And I remember I was going into the cancer center. I do a little PRN work now, because I said I like to work. And I remember going in the break room, the radiation oncology break room, and was putting my stuff away. And I'm still looking at my phone again going, gosh, can you believe this? Is everybody else reading this too? And one of the nurses came up and she said, what's going on? I said, I've got a very large renal mass consistent with RCC. And she goes, what? So, more people started coming in. So yeah, that was when my life changed.
We're confident you'll be able to learn some tips and tools to help you through your personal cancer journey. But first, we'd like to invite you to please give us a like, leave a comment or a review below, and share this story with your friends. Kindly click on the subscribe button below and click on the bell icon so you'll be notified the next time we post a cancer interview. And if you or a loved one are facing a cancer diagnosis, please click on the link in the description and show notes below to check out our free guide, The Top 10 Things I Wish I Knew When I First Got Cancer. Well, speaking of that, Claudia, so here you had you learned of this diagnosis of renal cell carcinoma. It's not a question of whether this is awful news. Of course it's awful news, but every person is different. Each diagnosis is a bit different, each cancer diagnosis. But if you take that whole equation into account, what was your reaction mentally and emotionally to all this?
Shock. It's like, oh my gosh. And I still wasn't putting that puzzle together that all those symptoms I had were probably, leading me to this point too. But it's like, okay, so, all right, looks like I've got a kidney cancer. So now what? What am I going to do? My motto my whole life has been, let's turn worry into action. So, of course, I start looking up my oncology, went straight to one of the navigators. And I said, which one of y'all takes care of the kidney folks? And this is a friend of mine that does head and neck and, another disease state. And she goes, what's going on? And I told her, and she goes, I'll be your navigator. So, of course, we sat down and started looking at that report again. And it's like, okay, what are we going to do here? It's like, okay. So by this time, my primary care that I've known for a long, long time, she's texting and said, I just got the results of your CT scan. We need to get you in to see a urologist. So that was when I really started getting my oncology work family going, because all the cancer committees and all that, there's specialty physicians sitting on the cancer committee. So a lot of people knew this urologic surgeon that's on the cancer committee, because he takes care of a lot of the nurses' husbands' prostates. And one of them saw him and they said, I'd already called and I couldn't get in for several weeks. And one of the nurses approached him and said, hey, one of our nurses has this and this, can't get in for a couple of weeks. What do you think? So, and you don't want to think you bumped anybody out of a slot, which I didn't, but he just happened to, decide he would stay late one day and see me. So I go over and I see my urologist that I had an immediate connection with, just an outstanding man. And he, pulls up the imaging, showing me everything. It's like, oh yeah, this is really big right here. That's got to come out. And so does your kidney. So I'm going, okay, so here we go. I'm turning that worry into action. I can't sit and fret about it or lose it right then and there. My world has been oncology. I know I'll be well cared for and I know what's going on, but I really didn't know that much about kidney cancer of all things. The breast cancer world, the lung cancer world, the prostate world, the colon world, all of those things. But I really didn't know that much about kidney cancer. Needless to say, I do now. So that's how that went down. And it was a couple of weeks before he could get in to do my surgery. Those 2 weeks were really the toughest weeks, but that was when I sprang into action and started looking on the internet. And I know, you have to be careful using Dr. Google. You want to use reputable sites, and I know what those sites are. So I started looking at disease-specific sites for renal cancer and, just getting myself psyched up for, whatever's coming my way.
Claudia, you mentioned turning worry into action. You've told us about the research you've done. Are there any other ways in which your being a nurse affected your approach to your treatment plan, your care plan?
Oh, I think it made it easier, much easier. I know about the, psychosocial aspects of it. Of course, I'm in shock. You just read this, that you've got kidney cancer on a little tiny screen on your phone, that the imaging guy, and a point I want to make here is most kidney cancers are found incidentally. We weren't looking. This was a CT of my chest. Your kidney is not in your chest. It's in your abdomen. So thank God for these, brilliant and diligent and thorough radiologists, because he was able to see far enough down. Of course, the mass was very big to say, oh yeah, by the way, here's what's going on too. So I think it helped me, because I knew people that knew a lot more about this disease and what was going to happen next. So yeah, has anybody ever prepared for it? Man, I can remember, this is kind of an odd thing to say. Decades ago, I was thinking, well, as I get older and if something happens, I hope it's heart disease, because I don't know much about that. And then as time went on, it's like, oh, heck no. If I get something, I hope it's cancer, because I'm well connected with that community, which made it easier for me. But because of all those tremendous resources right here at your fingertips, at the computer or on your phone, everybody can be well connected. And the thing about it is just to ask questions, ask a lot of questions.
Now, you had mentioned the 2-week waiting period as being very difficult, but once treatment got underway with the removal of your kidney, what was the toughest part of that phase, going through that whole thing?
Bruce, I was really, really blessed to have a pretty easy recovery period. The surgeon is just a tremendous man. And, he prepared me that, the way it goes, he does a hand-assisted laparoscopic nephrectomy. So that means I have a very small, like a 5-inch incision, a little above my belly button, a little bit below, and they go in and use the laparoscope and they disconnect everything. And then someone goes in there with their little tiny hand and pulls out this mass. Well, the mass turned out it was a 12-centimeter mass. It was very, very big. And there was another separate 4-centimeter mass that was also malignant that was pressing up against my pancreas. But we got good margins. That's what you want. So he was where I was going with this, and I kind of got sidetracked there. The way they manipulate, you've got a lot of bowel in front of your kidney. So they have to push that bowel out of the way. So they're pretty sure you're going to get that paralytic ileus. They put you to sleep, anesthesia puts you to sleep. Your body systems go to sleep too. So does your colon. And then when you've got that kind of physical manipulation, they're pretty sure it's going to have a hard time waking up, and you're going to get this ileus, like a bowel obstruction. So, hydrate really well. He does a few other special things, to try to avoid that. But he was pretty sure I was going to get that. I did not get that. I was walking that first day. I only did 2 nights in the hospital. 2 of my very, dear nursing friends. One stayed with me one night, one stayed the next. I probably would have been fine. When I came home, a physician's assistant friend of mine, dear friend, came over to stay for a few days, and I'm not very good at that, letting people help me. Well, most of the time, because I am self-sufficient, so I don't really need a lot of help. But in a situation like this, I do have enough experience to know that things can go south really quick. And if you're by yourself and you can't even dial 911, who are you going to call? So it's like, I'd already made my mind up when I'm thinking in that, week and a half, 2-week period, whatever people offer to do for me, I am going to let them do that. I am going to welcome that and cherish that love and kindness that they're pouring out to me.
Claudia, any other sources of support? It sounds like you have a pretty good, sounded like you had a pretty good support network. Any other sources of support that were difference makers for you?
Well, like I said, getting online, looking at the national disease-specific organizations. I have an amazing church family. My strength is in the Lord. They've been very, very helpful. My family back home in Mississippi, that's a long way away, but really all my immediate needs were met here in town, by my oncology family and my other close friends. When you don't have a husband and children, you get invited to a lot of things. People are always so kind and so gracious to include me. They're glad to share their children and their grandchildren. And I just love that opportunity. So really between my work family, my church family, all my needs were met. And my neighbors, I've got a very dear friend across the street. Her husband was diagnosed in 14, get this, with a renal cell carcinoma. And he was just recurring earlier this year in 2023 when I was getting worked up. So, what are the chances of that? So, she's my walking buddy. So I've got, dear, dear neighbors too. So just people, people's love, and everybody just wants to do for you.
Now, this already sounds rather positive, the support that you got from others. It sounds like you had a rock solid care team. When did you sense that your cancer journey was turning the corner, that things were getting better, that you were moving towards survivorship?
Well, and I'm still working on that. It's only been 10 months. But yeah, it's kind of that whole mental process until you kind of get over that shock and, oh my gosh, what is the deal? Because the surgeon started to talk about, some immunotherapy, and it's like, I don't know about that. Oh, so meanwhile, along the way, after I got my pathological diagnosis post nephrectomy, I have a lot of oncology friends down in the Dallas area. So I decided, because this is a very rare kidney cancer, 85% of the kidney cancers are called clear cells per the pathology. I'm a chromophobe. So only about 5% of kidney cancers are chromophobe. And that was another thing when I was doing the research, getting prepared for all of that. And it's like, you're looking at the different kinds of kidney cancers. It's like, oh, well, this chromophobe, it's very rare, only 5%, less aggressive, less slow growing, less likely to metastasize distantly. It's like, well, gee, that wouldn't be a bad one to get, but only 5% of the kidney cancers are chromophobe. That's probably not going to be me. Oh, ye of little faith, right? I'm going to be a clear cell, like, 75, 80, 85% of the renal cell cancer folks have. So I went down to the University of Texas Southwest to see a special genitourinary medical oncologist. I was fortunate, like I said, I've got a retired medical oncologist friend down there, and he helped me get situated with that. So I've got another navigator down there, because it is such a rare cancer, I felt like I needed a second opinion. And maybe even if it had been a clear cell, I probably would have gone down too. But what oncologists do, they follow the NCCN guidelines. Talks about how to diagnose, the workup, medical management of every kind of cancer that you've got. And I can get on it as a medical professional, but you don't have to be a medical professional. It's open to the public. So to get on there, and that was what it was saying, because I'm NED, my new best friend now, Ned, Bruce is Ned, no evidence of disease. Nobody's going to say you're cured, but Ned is my best friend now, and I'm on active surveillance because clear margins. It's a chromophobe. I get CT, chest, abdomen, and pelvis every 3 to 4 months for the first 2 years. That's my greatest chance of recurrence. And then that interval spreads out. So exactly what they told me, the specialty medical oncologist at UT Southwest in Dallas told me, was what my oncologist here at my cancer center told me too. So that's where I am 10 months out. So I'm still working. Now I've turned the corner already because I feel so good, and I felt really good. I kept moving. It is kind of weird when you start thinking about, I've only got one kidney. Okay, save the kidney, because when you start thinking about quality of life, if my one kidney goes south, then, dialysis. 3 times a week. That's not fun. That's really going to put a cramp in my travel plans, trying to work that out. So, I've got a nephrologist now. I've never had so many ologists in my life until this year. So we're watching my blood pressure. I've met with a dietitian. We're, watching my sodium, not drinking soft drinks, no processed foods. I've, just cleaned up a few things. You can't take, because of this back pain I've had. I've got, of course, at this age, we've all got most of us have osteoarthritis. You're always doing, a handful of ibuprofen or whatever it is. Well, the NSAIDs, your ibuprofens, are not good for your kidney. So all I can do now for back pain, arthritis pain, headache, whatever, is Tylenol, which, surprisingly enough, after I had the nephrectomy, my GI symptoms got better, my back pain got better, which just says that was all that kidney cancer that I didn't even know I had. So yes, the adjustment has been thinking I've got one cancer, one kidney. So, should I not zip line? Should I, what should I be careful with? And it's like, that's what the urologist told me, my surgeon. He goes, Claudia, just go and live your life. And it's like, yes. And having had a lifetime in oncology, Bruce, I was already living my life. I'm just doing it perhaps a little more intently now while I'm not working around a treatment schedule. I have come to the fact and the acceptance that this is going to be chronic, because I keep reading about it and all that. It's going to be chronic. I'm not going to die from this, but I do want to keep my one kidney healthy.
Our guest is Claudia Tatum of Tulsa, Oklahoma. She has survived kidney cancer. But as we mentioned at the top, that does not end her journey. Claudia wants to give back, and she is giving back by helping others. Claudia, I want you to talk about, for a bit, your involvement with the Kidney Cancer Association, how that came to be, and what you do with the Kidney Cancer Association now.
Thank you. Yes, the KCA, the Kidney Cancer Association, as I mentioned earlier, when I'm looking on the internet, at the websites, and there's several other similar organizations. So trying to figure out, which one is the ideal one to get, and nobody, my urologist didn't recommend anything, but I happened on the KCA and I got on there and I'm reading, and they've got a patient education booklet. And it's a real booklet. It's a hard copy right here too. I had it probably in a week because I already knew from the imaging, so I could start looking at that. But interestingly enough, so many times when you're online and you sign up for some educational material, it's just a download. Oh my gosh, I am so old school. I like a hard copy because I'm going to write in it and do all that. So you can't imagine how thrilled I was when I got this book in the mail. It made a huge difference. I'm going to read you something. This was on the very first introduction page. It's like, okay, you just got your kidney cancer diagnosed. You're feeling overwhelmed and scared. Take a deep breath. Here we go. Realize that you have already been living with this kidney cancer for some time, even though it was just discovered. So yet again, putting that thought in your head. So it's like, okay, I've got kidney cancer. What am I going to do? So there's plenty of opportunity on their website to sign up to be kidney cancer ambassador. So I signed up to do that. I've got a conference call with some regional folks. They're trying to really ramp up the kidney cancer awareness program. So I'm going to try to do something, not going to try. I will be doing something in March for Kidney Cancer Awareness Month in Tulsa, a walk, something, a fundraiser or whatever. And that's the struggle, especially with a chromophobe, because it is so rare. There's not a whole lot of data out there about how to best medically manage us if we need something more than surveillance. So, research costs money. So I'm going to get on the bandwagon with that. I also, they were looking for people to sit on the Patient and Caregiver Advisory Council. And they were asking you to apply. I was like, well, I'll apply, probably won't get on it, but, I'm going to try. You don't know until you try. And sure enough, I got accepted for that. And it's like, oh, this is just so terrific. So, working with them, just trying to improve the educational materials and meet patients' needs. And then there's another organization that they partner with called Emmerman's Angels. It's a mentor program. So I signed up for that right away, and I'm already talking to a young man in North Carolina that was diagnosed with a clear cell earlier this year. So, that was from the get-go, when I'm turning that worry into action, it's like, okay, what is my lesson learned here, and how can I best use it to serve the Lord? So there you go. I'm going to do everything I can to help other people, because most people don't know much about kidney cancer. It's not one of those top cancers that everybody knows about.
Okay, and you mentioned the website, and I have checked it out myself. There's just a wealth of information.
Oh, yes.
On the KCA website, and the web address is Kidney Cancer Association, one big, very long word, kidneycancerassociation.org. That's how you find it. And again, all manner of information with respect to kidney cancer. Claudia, we're going to wrap up now, and just as we begin our interviews in pretty much the same way, we like to end them the same way, and we end it with this question. Let's say that you happen to run across somebody who was just diagnosed with renal cell carcinoma, and they were just diagnosed, they didn't know what to do, and I'm sure that you would have a wealth of advice for this person. But if there's one thing that you wanted to make sure resonated with this individual, one point you wanted to make sure you got across, what would it be?
Of course, as we said, the Kidney Cancer Association has a whole lot of information. You've got to ask a lot of questions. And until you get that information, you really don't know what to ask. Communicate with your healthcare team, with your support team, just you have your family, just everybody needs to be talking about this. And, I've seen a lot of this over the years that people don't want to tell anyone that they got diagnosed with cancer or whatever. It's like, oh, I'm telling everyone. I want people to know that, we're living with cancer. Cancer is a chronic disease. It's not a death sentence. So, do your research, get a second opinion. Feel comfortable, with the people that are taking care of you. Somebody's going to go in and open up your abdomen and stick their hand in and take out your kidney and your adrenal gland. It's like, oh my gosh, you really want to make sure that the people that are taking care of you, and this is information you can get off the NCCN guidelines as to what they might be doing for you. And that's another plus that the Kidney Cancer Association does. They help you connect with, national cancer designated cancer centers that have specialists. They're going to connect you with somebody to get a second or a third opinion. So yes, you got time. It's not urgent. Do your research, ask some questions. And just be positive. Keep moving. And of course, after the fact, keep moving and hydrate. Drink a lot of water when you got one kidney.
Excellent, Claudia. Lots of sound advice there, and a great story that you shared with us. Excuse me. Anyway, that's going to wrap up this episode of Cancer Interviews, and we want to remind you, as we always do, if you're on a cancer journey, you are not alone. There are people out there like Claudia. There are organizations like, excuse me again, the Kidney Cancer Association, which can be found at kidneycancerassociation.org, that can be of help to you. So until next time, we'll see you on down the road.